Welcome to the Cherokee Indian Hospital Authority in Cherokee, North Carolina. Our core purpose is simple, yet far-reaching: to be significant in the lives of the patients we serve and to ensure the prosperity of the next 7 generations of the Eastern Band of Cherokee Indians. That promise greets you the moment you step into the rotunda. The circular room and the 45-foot oculus were inspired by a basket gifted to architects working on developing the design of the facility, an unexpected change that reminded us to steward what the people value most. Around the outer edge of the rotunda, the name of our Cherokee communities anchor us to our responsibility. Healthcare here is a pre-purchased inheritance, and we are its caretakers. Look down to the water spider at the center. According to the Cherokee creation story, the water spider, small yet brave, brought fire to earth on its back to bring warmth to the other animals. That's how healing works here: quiet, smart, and from the heart. Uwashan Udinatelan, the one who helps you from the heart, is a guiding principle for every interaction, from a greeting at the door to a bedside conversation at midnight. In the pharmacy, you'll spot the buzzard sculpture. Like the water spider, the buzzard holds the story of creation for the Cherokee people. Buzzard was sent to earth to prepare it for others. As his wings collided with the ground, they created valleys. And as his wings rose back up, the mountains rose with them. Chia's pharmacy is the primary pharmacy for our patients, filling both the needs of inpatient programs as well as outpatient prescriptions. Here, between pharmacy and primary care, the river of life flows underfoot. Terrazzo tiles carry plants, animals, and patterns familiar to Cherokee people. This isn't decoration. It's a gentle wayfinding ribbon and a daily reminder of Chia's guiding principle, Tohi, the peace that comes when things as they should be in balance with one another. Group harmony matters to us, which is evident into the architecture of the building, where spaces are open and inviting. Waiting areas glow with natural light, and culture and tradition warm places where anxiety often lives. As we move down this hall, notice how the building curves rather than turns sharply. You can see all the way ahead, making it easy to find your way. That's on purpose. Engagement, emotional and intellectual, starts with good design. Beams shaped like tree trunks carry the forest inside. Etched glass and branch-like supports upstairs echo the canopy. Culture is not an overlay here. It is the structure. It is in the medicine, and it is in the foundation that dictates the care we provide. We endeavor to serve as the provider of choice for the Eastern Band of Cherokee Indians, and in order to accomplish that, our primary care department is committed to deliver an integrated care model that is patient-centric and focused on whole-person care. Primary care is organized into pods, modular spaces where nurses, providers, pharmacists, and care managers collaborate in real time. Our patient-centered medical home draws from Alaska's NUCA system of care and adapts it for Cherokee people. Excellence is the pursuit of better systems, one roof, one team, one plan, with primary care team members such as behavioral health specialists or nutritionists deployed as engaged to wait. A dental visit today might open the door to vision care, to counseling, to chronic disease management tomorrow. That continuity is compassion at scale. Primary care being located in the same facility with specialty services like our rehabilitation department, with resources like wound care, speech therapy, occupational therapy, and physical therapy, the departments can collaborate together seamlessly to keep patient health at the forefront of the care we provide. At the end of the hall, just before entering Analanishki, Chia's behavioral health department, you'll find the mosaic design featuring Bear in the Lake. In this Cherokee legend, the animals search for a hidden lake, a lake that possesses healing powers. The bear enters and experiences renewed strength, endurance, and healing, the same thing we strive to provide to patients entrusting Analanishki with their care. This is Analanishki, which translates to "they are beginning." In addition to our inpatient program, outpatient therapy substance use treatment, trauma-informed care, child and family services, and school-based support live here. The Recovery Center is a drop-in style space for clients in recovery to access during the workday. Whether that is to visit with friends, talk with a peer specialist, or just relax and watch some TV, the center helps to build community and belonging. Our mission, accessible patient and family-centered quality care, shows up in the model, integrated teams, low stigma, and doors that open to the next level of help when you're ready. Chia's guiding principle, Digwadzeli Ushti, like family to me, guides the compassionate care we provide at Analanishki to grow healthy relationships that are formed in families. Behind the scenes, the off-stage side of Chia keeps the front calm. To reduce the stress and anxiety many experience when seeking medical care, Chia's design ensures the day-to-day work of running a medical facility can be conducted out of sight of patients. Staff move supplies, huddle, teach, and rest so patients don't feel the logistics and instead can focus on their health. Chia's Sacred Fire Courtyard, shaped after a traditional stomp ground, serves as a place to reflect, pray, and gather for both patients and employees. The Cherokee Indian Hospital Authority Medical Inpatient is designed to meet an array of needs for our patients, from short stays, observation, or acute care, to extended visits for patients nearing final stages of their lives with 2 dedicated hospice suites. Throughout the inpatient unit, patient rooms use warm wood head walls and foot walls with a tree motif and are designed with a consideration for hospitality because the environment is part of treatment. Stewardship isn't spending less, it's investing wisely in what helps people heal. Our hospice rooms include private family space beside the patient's bed so loved ones can be close. Chia's guiding principle, Uwashan Udanatela, the one who helps from the heart, guides end-of-life care. Dignity, presence, and tradition are not extras, they're the center. The second level of Chia is home to our ambulatory services such as dental, eye, and complementary medicine, acupuncture, massage therapy, and traditional healing practices. Co-locating services reduces friction. Integrity means aligning what we say with what we build. If we promise accessible whole-person care, then everything people need should be close at hand and easy to navigate. Department signs include Cherokee syllabary because language is care. When we worked with the Cherokee Speakers Council to translate various aspects of the hospital, some departments, like dental, didn't have an exact translation, so their Cherokee name often depicts a deeper and often more meaningful explanation of the care we provide. For dental, translates to the place that makes you smile. That is when something as simple as a name becomes a mission. Our full-service dental clinic includes 21 operatories, 18 of which are outfitted facilities with windows, allowing patients to take in scenery from their dental chair. There is a dedicated unit for pediatric dentistry to deliver on our promise to caring for the next 7 generations of patients. Our vision is to be chosen for excellence and recognized for improving the health of the Eastern Band of Cherokee Indians. And that only matters if care reaches people where they live. That is why Chia includes a network of satellite clinics and services off-site from the main campus, which includes the Immediate Care Clinic, clinics in Cherokee County and Snowbird Community in Robbinsville, Kanewotiyi Residential Treatment Center with gender-specific cottages, men's and women's recovery support homes for transitional housing, and Zali Care Center with 120 long-term care rooms. We end where we begin, under the basket-inspired Oculus, standing on the water spider who carried fire home. The hospital blends the best of modern medicine with the wisdom of Cherokee tradition, design that lowers stress, teams that collaborate, language that welcomes, and landscapes that heal. Nihi Zadzeli, it belongs to you. is not just a phrase that welcomes our patients. It's the guiding principle that drives how we make decisions, how we greet our patients, and how we plan the future. For the people here today and for the next 7 generations, we serve from the heart in balance like family in a healthcare system that belongs to our patients.